You've heard the saying, drink 8 glasses of water a day to stay healthy. If you feel sick, drink water. If mom looks weak, give her more water. But what if I told you that for many older adults, this advice is actually dangerous? I have treated patients who were rushed to the emergency room not because they were dehydrated, but because they drank too much water. This is called water toxicity. It causes your sodium or salt levels to crash, leading to confusion, seizures, and even brain swelling. To understand why this happens, think of your blood like a soup. For the soup to taste good and for your brain to work, it needs the perfect amount of salt. If the soup is too salty, you are dehydrated, and that's bad. But if the soup is too watery, your brain cells literally swell up like a sponge. So how do people accidentally ruin their blood soup? Usually, it's through one of these 3 culprits. Culprit number 1 is drinking too much water. Once in a while, I encounter a patient who forced themselves to drink 2 to 3 liters a day because they think it flushes out the toxins or keeps the bladder clean. But here's the reality. Your kidneys are smart filters, but as we age, they get slower. If you pour water in faster than kidneys can flush it out, the soup gets diluted, the salt level drops, and your brain swells. The second culprit is not eating enough salt. Sometimes, older adults might find it troublesome to prepare food for only themselves. So they live on a diet of biscuits, toast, and tea, without any meat, any eggs, and no real meals. And because they aren't eating a nutritionally balanced diet, even a normal amount of water becomes too much, because there's nothing in the blood to balance it out. The third culprit is the leak. This is about your medication. Many older adults are on water pills or diuretics for high blood pressure or for leg swelling. And these pills force your kidneys to throw away salt. If you're taking these pills and you're also forcing yourself to drink 8 glasses of water a day, you are creating a disaster. You're dumping the salt out and pouring the water in. The scary part is the symptoms of low salt. So when sodium drops, you don't feel thirsty, you get confused, you get drowsy, and you might stop making sense. Families often rush patients with low salt to the hospital thinking, oh no, dad had a stroke. Is this sudden dementia? But it is not. It is the water. So, how do we fix the soup? This is tricky, and is why you must not play doctor at home. The treatment depends entirely on why the salt dropped. If the problem is too much water, we restrict water. We might limit you to 500 ml to 1 liter of water a day. But if the problem is caused by water pills or starvation, your body might actually be dehydrated. And in those cases, stopping water makes it worse. We actually have to give you salt water through a drip in the hospital to flush out the imbalance. It is a seesaw. One direction saves you, the wrong direction damages your kidneys. You need a doctor to evaluate you and set a direction. Also, and this is a critical part, never try to fix this at home by eating a bag of potato chips, for example. If you raise the salt levels too fast, it can strip the nerves in the brain and cause permanent damage. This must be done slowly and carefully in a hospital setting. So here's the rule. Trust your body. You don't need a target like 8 glasses of water a day. If your urine is pale yellow, you are fine. If you aren't thirsty, don't force it. Water is life, but just like everything else in medicine, the dose makes the poison. I'm Dr. Lim, and I'll see you around. Bye.